Assalamu alaikum guys, welcome back to my YouTube channel. Today we are going to discuss about the optic nerve pathway from the time it starts at the retina and ends at the primary visual cortex. So we can just discuss about the various stages and the lesions that can occur if the optic tract gets disrupted at any place during its course. Let's draw the eyeball first. This is the left eyeball. This is the right eyeball. This is the retina. So the optic nerve starts from the posterior aspect of the eye. It starts from the retina. And we call the optic nerve to the point where the optic chiasm starts. Till this part, it is known as the optic nerve. Now here it makes the optic chiasm. Here the optic chiasm starts. The optic chiasm is basically the crossing over of the retinal fibers to the opposite side. Now here the nasal fibers only cross over. Now this is the nasal aspect of the eye, the nasal part we can say. This is the temporal side. Now the nasal side carries the fibers of you can see the temporal field of vision from the nasal side, whereas the temporal side is responsible for the nasal aspect of your vision. Now the nasal fibers, as we said, it has the temporal side of your eye field. So that means the light rays from the temporal sides strike the nasal field of the eye like this. Whereas the light rays from the nasal side of the eye, the nasal field of vision, they strike the temporal side of the eyeball. Now, these nasal fibers, when they are carried through the optic nerve, they cross over to the opposite side in the optic chiasm. Whereas the temporal fibers, they do not cross over and they continue on the same side of the eye. So we can say the nasal field of vision is carried on the same side, whereas the temporal field of vision crosses over to the opposite side. This is very important when we discuss the lesions of the eyes. You will come to know the importance of this crossing over. So the nasal field is crossed over, the temporal field is going on the same side. Remember, the field of vision, when I'm talking about the field of vision, I'm talking about the visual field. But when I talk about the temporal side, I'm talking about this side. So the temporal side carrying the nasal field of vision stays on the same side. The nasal side carrying the temporal field of vision crosses over. Same happens on the other side. Now this is known as optic tract. After emerging from the optic chiasm, it is known as the optic tract. It's the same nerve, it's just in different names. So when the MCQ comes, make sure what you're reading and what you're talking about. Now this optic tract goes and terminates in the lateral geniculate body. It happens on the other side as well. Now after this lateral geniculate body, the fibers that arise, they are known as the optic radiations. But these optic radiation are divided into two parts. the temporal fibers and the parietal fibers. The temporal fibers, I'm going to label these as temporal fibers, and these as the parietal fibers. The importance is in the lesion. Now, if the lesion occurs on this means that you will have a problem on the inferior field of vision. We're going to come to that, but I'm just mentioning it this so you pay special importance to these fibers. Now, the parietal fibers means that these fibers travel to the parietal lobe, and these fibers travel to the temporal lobe. Temporal fibers, another name is Meyer's loop. This loop is known as Meyer's loop. But in the end, both of these fibers will terminate at the primary visual cortex. Their destination is the same. I'm going to draw this occipital lobe. So this sulcus is known as the calcarine sulcus. It is located on the posterior lobe, on the occipital lobe. So just one thing you should know if an MCQ comes, the Meyer's loop terminate on the lingual gyrus. Whereas the medial fibers that passes through the parietal lobe and also goes to the occipital lobe, they end on the cuneus gyrus. And both of these gyruses are separated by calcarine sulcus. So let's say, okay, one thing I want to add. Now the fibers for the light reflex passes through it before these fibers end at the lateral geniculate body. The fibers for the light reflex, they emerge and they have their own tract. They go to the midbrain. This is the midbrain. Now they come here to the pretectal nucleus. From this pretectal nucleus, they go into the Edinger-Westphal nucleus, but it innervates the Edinger-Westphal nucleus of both the nuclei, of both the sides. Then from this Edinger-Westphal nucleus, fibers go to the oculomotor nerve and causes constriction of the sphincter pupillae muscles of the eye. Now, let's discuss the lesions. Let's say if this optic nerve is cut here, what will be the visual field defect? Now the visual field defect, if that fiber is cut, it will result in complete visual loss of one side. If you cut the right optic nerve, what if you cut the optic chiasm? Let's go back to the diagram. I'm sorry I have to switch over again, but there's no space on this side. So this optic chiasm, if the lesion occurs here, what do you think is going to happen? The nasal fibers of both the eyes will be cut, but these nasal fibers, as we discussed, are responsible for the temporal field of vision. So you will get a picture something like this. This is the left eye, temporal field visual loss. This is the right eye, temporal field visual loss. And this is known as bitemporal hemianopia. Now, let's come to this part. If the optic tract is cut, what do you think will happen? Now, follow with me, go with me. On the same side we have the temporal fibers lost, but these temporal fibers are carrying the nasal field of vision. So what image will you get? Draw the diagram with me. This is the left eye. The temporal field of vision, the temporal fibers are cut, that is responsible for the nasal field of vision. So the nasal field of the left side will be cut. What about the opposite side? The opposite side has the nasal fibers cut, and the nasal fibers are responsible for the temporal field of vision. You will get something like this. This is known as right-sided heminopia or right heminopia. Let's come to the optic radiations. Now, if the optic radiations as a whole is cut, you're going to get the same presentation as the optic tract, but they are not so good to give you a simple MCQ like that, of course. They are going to cut either the parietal fibers of the optic radiation, or they're going to cut the temporal fibers of the optic radiation. So if we cut the parietal fibers of the optic radiation, what is going to happen? See, the parietal fibers are the superior fibers, but they represent the lower field of vision. So the lower field of vision, when these are cut, now these are responsible for one quadrant of the eye. Let me make the visual field first, then I will tell you how is it done. We're going to cut the eye visual field into 4 parts. Now the parietal field, they lie superficially, but they represent the lower field of vision. So the lower field of vision means that you're going to have problem on the lower side, leave the upper side. But this lower field, only the left side of the eye of the parietal fibers are cut. So we will cut the left side only, not both sides. If you want to cut both sides, then you should also have the problem on your parietal fibers of the right side. But you only have parietal fibers on the left side problem. So this side of the eye will be cut. This visual field will occur. And we call this left inferior quadrantanopia. Since it is divided into 4 quadrants, we call this quadrantanopia. Now let's cut the temporal fibers. Now if you cut the temporal fibers, they are placed on, they travel on the inferior aspect, but they represent the superior field of the eye. So if they are cut, what do you think will happen? The superior side of the eye visual field, they will have a problem. But since it's the left side, so we'll cut only the left side, because temporal fibers are responsible for the superior field of vision. But don't confuse their placement in the brain with the visual field. The placement to the visual field is their opposite. And in the end, both of these fibers, they decussate, or not decussate, sorry for that, they end at their respective gyri and the posterior lobe. In the primary visual cortex of this visual, just for information, the primary visual cortex is 17. If an MCQ comes, so you should know. It looks a little bit messy, this diagram, but I'm sure I must have explained it very well for you folks. If there are any questions, please leave it in the comment box. I'll be sure to give it. I'll explain it if I can. And if you want me to upgrade my videos in the new upcoming videos, please also give me suggestions. I'm open to it. Until then, take care folks.